Shields are classified as accessory protective devices that are made of lead and impregnated vinyl. They are used to protect both patients and staff from the biological effects of radiation when it's not possible to remain behind a protective barrier. Shields are available in a variety of shapes, sizes, and thicknesses. The thickness of a shield is described as the lead equivalent. As the lead equivalent increases, attenuation increases, therefore both the patient and staff are more protected against radiation. Here we have the correct way to wear a one-piece apron. These aprons are usually used in a non-fluoroscopy X-ray rooms and mammography rooms. These aprons have a lead equivalency of 0.25. Lead aprons should be worn by anyone present in the room during an exposure and unable to be behind a protective barrier. Here we have the wrong way to wear the one-piece apron since the whole front of the body is exposed and the placement of the dosimetry is not in the correct spot, which is on the collar of the apron. This is the correct way to wear the two-piece apron, which is usually worn in fluoroscopy cases and in the OR. If a worker could have their back turned towards the X-ray source during the procedure, a wraparound style should be worn since it offers the most protection. These aprons have a higher lead equivalency of 0.5. This is the wrong way to wear the two-piece apron since the front of the vest portion is not Velcro shut and the skirt is not Velcro together and is not overlapping with the top. These are the thyroid shields. These wrap around the neck of the patient or the staff to cover the thyroid, which is highly radiosensitive. As you can see here, the thyroid shields have a lead equivalency of 0.5 and even give you instructions on handling them so that the lead inside does not break and become defective. Rolling shields are for patients' protection. They have a lead equivalency 0.25 to 0.5 millimeters. They should be rolled either in front or behind the patient depending on the patient's position, and they should not be in the light field. These are used for adults and pediatric patients when they are standing at the wall. Bucky lap shields are used for protection of the reproductive organs of adults and pediatrics when the patient is laying down on the table or sitting in a chair. The small green shield can be used to wrap around a pediatric patient if they are standing. The lead equivalency is 0.25 to 0.5 millimeters for these shields. They should be placed on top of their lap, not in the way of the anatomy of interest. This would be an incorrect placement of the lap shield since the corner of the lap shield is in the anatomy of interest, which is in this case is the thoracic spine. As you can see, the patient is not very happy to have to get additional radiation. For pregnant patients, a lap shield or a rolling shield would be the best way to shield a pregnant patient. Just make sure the whole abdomen is covered as well as the pelvis. If there was a pregnant radiology tech, then the tech would wear the lead apron but would also have a second dosimetry to clip to her stomach so the fetal dose can be tracked. Radiopaque glasses have a lead equivalency around the lens and sides of the glasses of 0.35 to 0.5 millimeters. These protect the lens of the eyes of workers and are worn by radiologists and techs when they are doing many fluoroscopy and IR cases to decrease the scatter radiation hit the eyes. Lead gloves have a lead equivalency of 0.25 millimeters. The gloves should be worn whenever the radiographer's hands must be placed in the fluoroscopic field, like if you hand the patient the cup of contrast to drink or if you have to move their leads out of the way. Protective lead drapes are there to protect the radiologist and radiographer by absorbing scatter radiation. These drapes have a lead equivalency of 0.25 millimeters. These drapes are also removable so that the table can be converted into a normal X-ray table. Bucky slot cover is there to covers the Bucky slot opening during fluoroscopy. This device is used to protect the radiologist and radiographer at the gonadal level. It has a minimum lead equivalency of 0.25. Another way radiology techs can shield themselves during fluoroscopy is by using a concept called Operation Human Shield. This when the radiology tech stands behind the leaded radiologist, creating another barrier the scatter radiation has to travel through before hitting you. Lead should always be hung on hangers. Never fold the lead because it can cause cracks, making it less effective. Shield should also be stored at room temperature and out of sunlight so that the integrity of the shield is maintained. All shields should be inspected by quality control annually to check for cracks in the lead. At least one apron should be stored on the portable machine. In April 2019, the American Association of Physicists in Medicine stated that patient gonadal and fetal shielding should be discontinued based off of research which found that shielding may interfere with the AEC system, cause unnecessary repeats due to poor placement, and actually increase patient dose due to attenuation characteristics of the shield. The AAPM formed CARES committee whose purpose is to educate the profession about the risks associated with gonadal shielding. Areas that should be shielded due to their high radiosensitivity: breast, thyroid, and eyes. This is because we can try and eliminate the risk of cataracts and cancers.